An important aspect of 340B and FQHCs these days is advocacy. In the current climate we're in the 340B space, it's important that all health center employees working in 340B are active advocates. And I know that that's sometimes intimidating for a lot of people. It's important that everyone that works in a health center knows that they have a role in advocacy. Now, that might not be actually going to the State House or going to Capitol Hill and talking to legislators, but it may be talking to your community members about the opportunities that your health center has, as well as the impact that the 340B program will have for your patients. A common barrier for those working in 340B within an FQHC is that they don't feel empowered to take on advocacy themselves. Often, they don't feel like they're able to actually be an advocate because advocacy isn't part of their job description. In FQHCs, we wear many hats, and frequently, leadership will be supportive of the 340B employee working in advocacy if they only ask. To me, one of the most important points when you're talking to legislators and policy members is to know your audience. You could be saying the same exact thing, but saying it in a different way, depending on who you're talking to. If you're talking to a more conservative legislator, you might frame your message differently than if it's somebody more on the progressive side of the aisle. That doesn't mean your message changes, it's just a different way to frame it. For example, if you're talking to a conservative legislator, you might focus on the fact that 340B saves the taxpayer expense in appropriations. Where if you're talking to more of a progressive legislator, you might focus on those social determinants of health and the way 340B provides health equity. It's all the same message, it's just told in a different way. While we're seeing some movement in 340B reform at the federal level in Congress, most of the action has taken place in the state houses. State legislators are addressing the contract pharmacy restrictions with state legislation addressing the fact that these manufacturer restrictions are affecting drug distribution. Drug distribution has historically been an action that the state regulates, so this is a method that has proved successful in many states. States that have instituted contract pharmacy protection bills in their state houses are seeing manufacturers comply with those laws and contract pharmacy purchase being reinstated. If you're in a state that hasn't yet passed a contract pharmacy protection bill, you can work with your state primary care association as well as other groups in order to form a coalition and get a bill introduced. Until Congress acts on 340B reform, the state laws are the best way to reinstate those 340B purchases at our contract pharmacies. States that have been successful have not only addressed the contract pharmacy distribution directly, but they've also prohibited things like data submission to make sure that they close all the loopholes so they don't have a problem in the future. In a program like 340B, advocacy is such an important aspect of the landscape. Because of the importance of advocacy, you can't assume that someone else will do it for you. I know sometimes it feels like it's impossible to get started with advocacy, but it's important that each one of us take it upon ourselves to be great advocates and not assume someone else is going to do it for us. If you're struggling getting started with advocacy, there are people that can help. You can contact your state primary care association, the National Association of Community Health Centers, or us at FQHC 340B Compliance. We can assist you in developing your 340B advocacy plan, draft talking points for legislators, or even help you write a testimony for a committee hearing. Contact us today at fqhc340b.com.